Governors have taken the lead here where we've needed to. Now is not the time to pull back at all. It is the time to intensify.
Good afternoon. Welcome back to Washington Post Live. I'm Bob Costa, national political reporter here at the Washington Post. Joining me this afternoon is Governor Gretchen Whitmer of Michigan, a Democrat. She was elected in 2018 after a long career in state politics, including serving in the state legislature, where she was minority leader of the Michigan Senate. And a few months ago, you may remember, it feels like a long time ago, but she did deliver the Democratic response to President Trump's State of the Union address. Governor Whitmer, welcome to Washington Post Live.
Thank you. Good to be with you.
Governor, based on the data and what's happening in your state, are you thinking about extending the stay-at-home order in Michigan beyond May 1st?
Well, there's no question that we have to be very slow and methodical. We have to pay attention to the data, listen to, the medical experts and our public health experts to know that we are ready when, and then what does it look like when we do begin to re-engage, and to be mindful that there are different sectors of our economy, different sectors of our regions of our state, for instance. And so we're going to be really data-driven. We have a rigorous, exercise that we are going through right now to plan this work. The odds are that everyone will resume life as normal are zero. And so what we do know is that we will have to be very slow. And for some, we will continue to be in the posture that we are currently in. For others, we will start to ramp up a bit where it's lower risk and where we can think we can do so safely without risking a second wave of COVID-19. And so some form of an order will continue on, but our hope is that we will start to slowly re-engage sectors of our economy that in a way that keeps our employees and our customers safe alike.
So to follow up on that, what kinds of sectors could be reopened in May, even if part of the stay-at-home order remains in place?
Well, my order is one of the most aggressive in the nation, and I think that we can look to what other states have been doing to understand where there is additional risk or not risk. As we assess beyond that first wave, and there will be many waves of opening up a variety of sectors of the economy, we're asking questions like, is it indoor or outdoor work? How closely does it interface with the public? Is it, getting your nails done, which is you're touching one another, or is it a landscaping activity? Is it something that there are shared tools or machinery? These are all things that impact the risk associated with a various type of business enterprise. And so these are just three out of, many factors that we are looking at to score and to work with our public health experts and working with the University of Michigan and a number of experts around the state of Michigan, so that we are really mindful of where the lowest risk is. We'll try it out for a little while, watch the numbers, make sure that we're still able to meet healthcare needs in regions of our state, and then perhaps take the next step. But we have to be nimble enough to recognize where there's been a growth of COVID-19 where we pull back. Or if there hasn't been, where we take maybe the next cautious step forward. And so we're going to be very careful. We're going to pay attention to the science, and we're going to protect people every step of the way.
When you look at that phased reopening that could happen in Michigan, are you open at all to what the Republicans in your state house have proposed, this 3 tiers in the state in terms of reopening in that framework, or do you support a different plan?
I think that there are some things that would complement the work that we're thinking about and the work that we're planning to do. Certainly, we need to build alliances, and I welcome all input, no matter where it comes from. But at the end of the day, the most important voices, I think, helping us direct and phase this in safely are those of our healthcare experts. And so the work that we're doing centers around the best science. We've got to ramp up testing. We need to see, continually flatten and declining in terms of the curve and hospitalizations. And so there are a lot of different factors that go in. I'm sure that there are pieces of a variety of plans that I'll be taking in order to fashion the right one for my state.
Governor, when you say ramp up testing, are you speaking of something specific there? Because we hear so much about testing, but what does Michigan really need when it comes to testing?
Swabs and reagents. It's really that simple. And it's these tools that go into the test that we're all competing for, that we're all trying to get. My hope is, I know that there was a comment by the White House that they would be moving forward and using the Defense Production Act to start producing swabs. I haven't seen if that's really going to become a reality or not, but I do know that that is one piece of the test that we don't have enough of. We could maybe do 2 or even 3 times more testing than we are right now, but the fact of the matter is we need those swabs and we need reagents so that we can process those tests.
You've recently started a task force in Michigan to look at racial disparity. What will that group do? What do you hope it achieves in terms of policy, not just studying the issue?
Yeah, well, we know, and Michigan was one of the first states to start reporting data about the race of people that are testing positive for COVID-19 and people that have lost the battle with COVID-19. I think it was us and Illinois. I know you're going to talk to my friend JB shortly, and Louisiana. We need to prioritize this as a country. This is holding a mirror up to our country and the generational inequities that people of color have confronted. The inability to get a good job that has health care along with it. The inability to access health care in a meaningful way. There are a lot of different factors that go into this, and that's precisely why it's not good enough to just have the data. We got to study it, and we've got to put together a plan for how we attack the root problem here. But when 14% of our population is African American, and yet 40% of the deaths, there's no question that this has disproportionately impacted people of color, and we have a duty to understand it and to address it.
Is there anything the federal government could do on that issue?
Yeah, so a few weeks ago, when the data first started coming in, before I think everyone was focused on it, we saw the difference. And I raised it in a conversation with the vice president and acknowledging that we think there's a racial component, a very serious one, and we'd like the federal government, the full weight of the federal government, to help get all of the data to coordinate. I've been vocal in terms of my observation that we really need more of a national strategy on a variety of fronts, and this is one of those as well, because what's happening in Michigan is we're seeing that it's happening in other parts of our country as well. And so it really needs to be a national issue with a federal solution as a part of it.
Do you feel like Vice President Pence has been effective for Democratic governors like yourself as head of the task force?
I have found Vice President Pence to be very cordial and accessible, and I appreciate that. I think as a former governor, especially one from the Midwest, we've been able to build a type of rapport, and I know that's not unique to me, that he's done that with a lot of governors on both sides of the aisle across the country. We need to make sure that governors have all of the tools we need to lead on this moment, to protect lives and to hopefully, responsibly ramp back up our economies. But we need complete partnership from the federal government. I have found the vice president to be very helpful and, as I said, accessible and responsive.
What did you think? What was the first thing that went through your mind, Governor, when you saw President Trump tweeted, "Liberate Michigan"?
Well, we had just come off of a demonstration at the Capitol, and we had a lot of people show up who were not wearing masks, who were not staying 6 feet apart. I saw adults handing things to children, barehanded, and we know that this kind of activity flies in the face of all of the best science, including the scientists that are standing up at the nightly briefing with the president, who have told us 30 days, they have promulgated a lot of the same best practices that we are encouraging people to undertake. And so to see this play out, I think was really unfortunate. And I worry that while I respect their right to dissent and to demonstrate, so long as they're doing responsibly and they're not endangering themselves or other people, I respect that. But to see people come from across the state and converge, to stay that close to one another and to congregate like that, and then to go back into different parts of the state is very concerning, because I know the purported rationale for it was they don't like the stay-home order, and yet that activity might necessitate lengthening the stay-home order, because if they've brought COVID-19 into parts of the state where it wasn't prevalent before, that's going to be a problem for us to re-engage, at the earliest possible moment.
You said you respect their rights, their First Amendment rights to protest. At the same time, you do raise public health issues and concerns. So if there are future protests, are you considering at all shutting down those protests or bringing in a police presence to try to enforce social distancing at some level?
Well, I think that there are a lot of complications with that. We've got a lot of first responders who we have to protect their health as well. And throwing a number of people into jail is not a thing that I think is a smart strategy when you are trying to stop the spread of what is a global pandemic. And that's precisely why on the phone call with the governors yesterday, I did ask the vice president for some assistance from the federal government to reiterate how important it is to observe these stay-home orders. Now, the good news, I know we've all seen the pictures of these demonstrations, but the good news is the vast majority of people in my state and in all these other states that are having demonstrations, the vast majority of the people are doing the right thing. We see that bear out in the numbers of what Google will tell us how much people are traveling. We see that bear out in terms of a curve that continues to flatten. And so the vast majority of people are doing the right thing. If we could get some support out of the federal government to reiterate how important it is to stay the course, to stay at home, that's how we stop the spread, and that's how we get to a place where we can safely start to re-engage sectors of our economy. And I know that's what everyone wants.
But when you watch those protesters, and I know you're trying to work with the federal government and Vice President Pence and even President Trump, do you partly hold President Trump responsible for the unrest in your state?
Well, I do think that a consistent, cohesive message from everyone who has a platform would go a long way toward quelling some of the anxiety that people are feeling. I get it. People are feeling isolated. They're lonely. They're worried about their business reopening. They're worried about getting a job again. A lot of people are mourning the loss of loved ones. I mean, this isn't easy. But I also know that this is a finite period of time. We're asking people to take this action now for the betterment of everyone. It's not about taking your right to assemble away. It's about making sure that my father's right to live is protected. And that's the trade-off here. We're not asking people to go into our factories and build bombers like we did in World War II. We're asking people to stay home. That's what doing your part looks like in a war with an enemy that is a virus. And so we need to focus on the fact that this is a short period of time, and we all have to do our best to educate people, to quell the anxieties, and to encourage this behavior so that we can get through this better with fewer lives lost and in a way that we can safely re-engage the economy.
Governor Whitmer, I appreciate you having this conversation about the pandemic, but just one final question as a political reporter, I must ask. Has Vice President Biden or his campaign asked you for any vetting or personal information in recent weeks?
I have talked to Joe Biden many times. He checks in relatively regularly to see what's going on in Michigan. We've not had that conversation. I think he's a wonderful guy. I think he'll be, he's a great candidate. I am happy to be one of his supporters. I trust him implicitly. And at this point in time, I'm not spending any more energy in politics. All I'm focused on is trying to do everything I can to save lives here in Michigan.
So has he asked for documents or not?
No, not yet.
Governor Whitmer, I wish you all the best in Michigan as you deal with this pandemic. Thank you very much for your time.
Thank you.
And stay with us if you're watching Washington Post Live. Governor J.B. Pritzker of Illinois will be with us momentarily.
This will go down in history as a profound failure of our national government.
They didn't advise us to shut down major events, sporting events, parades. We made those decisions on our own. They are not the ones that advised us to close schools. We made those decisions on our own.
Folks, this curve may not flatten, and it may go up again if we don't adhere to the stay-at-home order. We need to stay the course for now for our efforts to truly remain effective.
Welcome back. Good afternoon. And if you're just joining us, I'm Bob Costa, national political reporter at the Washington Post. Joining me right now is Governor J.B. Pritzker of Illinois, a Democrat. He was elected in 2018, and before that spent years in business, philanthropy, and politics, often with a focus on Chicago. Governor Pritzker, thanks so much for being with us this afternoon.
Glad to be here. Thanks so much.
You've spent a lot of time in recent days on medical supplies. You've ordered personal protective equipment from China, airlifting it back to Illinois. What's the latest on that front?
Well, we've managed to get millions of items of PPE back to Illinois. We've been working on this project for really more than a month now, making sure that we've got the supply chain worked out so that we can get the gowns and goggles and N95 masks and surgical masks that we need to keep people protected. And then, of course, we've needed to acquire ventilators. That's a difficult endeavor. Fortunately, the way we've bent the curve now, it looks like we may need fewer ventilators than we did before, but we're still going to need an awful lot of PPE, especially as we move forward, thinking about how we're going to reopen aspects of the economy in the months ahead.
We got a lot of questions from our viewers and readers, Governor, about what drove the decision to turn to China for these supplies rather than to the national stockpile.
Well, the national stockpile has been depleted. The president and the federal government really have not distributed much of anything to the states, considering what we asked for. Here in Illinois, we've maybe received 10% of what we needed. And so they've turned it back to the states and said, well, you guys are on your own. So as you know, we've had to compete with all the other states and with other countries and even with our own federal government in order to get PPE. I didn't turn to China. I turned to the world, wherever it is that I could acquire it, whether it was here in the United States or elsewhere. As it turns out, most of the PPE that comes to hospitals and that's needed in the United States actually is manufactured in China. So we went to where the manufacturers were, acquired the PPE, and then shipped it over here directly to the state of Illinois.
Can you shed a little light, Governor, on the details? How much, in terms of these supplies, is in Illinois right now?
Well, we've acquired millions and millions of items of PPE. When we receive it, we distribute it. We have 102 counties and public health departments across the state of Illinois. And so we make sure they have what they need. And then we back up the city of Chicago and all the hospitals across the state to make sure they get what they need. So we're, in the business of being the stockpile for everybody here in the state, or at least the backup for them. And fortunately, we've been able to supply everybody with about 7 to 10 days on a consistent basis. And then, we know what the burn rate is at each of these places so that we can keep replenishing them.
Has the federal government been frustrated with your effort? Have they tried to seize any of the equipment at all?
We are aware that across the country, the federal government has seized items of PPE that have come in from outside the country. So they have not managed to interrupt our supply, or at least our direct supply efforts. And, we hired private aircraft to go pick up what we needed and have it delivered here. Those 2 flights that we already arranged have arrived here, and we have that PPE in our state stockpile.
It is coming from a different country, and it's not going through the FDA or other agencies. So how are you testing that equipment to make sure it's prepared for use by frontline workers?
So much of it is designed to meet the FDA specifications. And then when it arrives here in the United States and here in Illinois, what we do is we take it to our warehouses, and then we open up the boxes and make sure, you can't go through every single mask, but you take samples from each of the shipments that have come over to make sure that we got what we paid for, and also that it's effective and can be used where we need it.
So you're part of this whole national debate about when to reopen certain states. What does the data show in Illinois? Has Illinois peaked, or is it ready to reopen?
We have not peaked. And, one of the interesting things is, as you may know, we were the second state in the United States to put forward our stay-at-home rule. And people have really been abiding by it for the most part. And so the result of that has been the pushing out of what had been anticipated to be a peaking in the middle or near the end of April. So it's been pushed out now, according to the models, to maybe mid-May, but at a lower level. And so we're moving, inching toward that date. People are doing what they need to do in the state of Illinois, staying indoors or staying at home, wearing masks outside, as I've urged everybody to do, making sure they're washing their hands, and all the other things that we've asked people to do. So the result is that we've had many fewer deaths than were anticipated. Our hospitalization rate is somewhat stable, climbing a little bit, but somewhat stabilizing. And of course, our ventilator needs have gone down, interestingly, partly because we've bent the curve, but also because the treatment, the way that doctors are treating the people who seem like they need to go on ventilators, is now different than it used to be. They're trying to keep them off of a ventilator and instead using their own therapies, turning people over or having them lay on their stomach instead of their backs in order to oxygenate the entire lungs. So we're fortunate that all of that has developed over time and that we're going to be able to keep more and more people alive.
Governor, you said most people are following the rules and the order, but I did take note of a protest in Springfield, the state capital. Is there a divide between those downstate and those in the Chicago area when it comes to following your stay-at-home order?
Well, those are two different things. The protests that occurred in Springfield, I think there were about 20 protesters that showed up. There were about 10 counter-protesters that showed up, some of them nurses in hospitals, who understand why we need to have a stay-at-home order in place and are on the front lines risking their lives. Different question is the question of whether things are in rural areas of our state. Remember, 75% of our land mass in the state of Illinois is farmland. And much of the population is in the northeast corner of the state. And so when we look at all the counties, the 102 counties across the state, there really are different characteristics to each one. And so we've tried to look at we put in stay-at-home orders that were really across the board very effective. And now we've looked at what the infection rate has been, different in Cook County than it is in our collar counties, and different in our Cook and collar counties than it is in other counties across the state. And now I think we can make some adjustments based upon hospitalization rates, based upon ICU bed availability, based upon infection rates, as we look to how can we begin to adjust things and work toward, after the peak, really reopening the economy.
When you say some adjustments, Governor, is it fair to predict that in May, when you think about your emergency powers, you may keep the stay-at-home order for some counties, but allow other counties in the state to open up?
Well, we're certainly looking at, like I said, the different characteristics of regions of our state. And we're going to make adjustments here based on what we've learned and seen in the infection rates. And I'm doing all of that, though, based upon the advice of the epidemiologists and the scientists and the data that we've got.
What about that coalition of Midwestern governors who are trying to decide together? Does that weigh in on your thinking at all?
Well, I saw that you had Governor Whitmer on just before me, and I have great respect for her. She's really dealing with quite a lot in Michigan right now with the infections and hospitalization rates, and she's done a terrific job. What I'll tell you is that we all got together to talk about what are the common principles that we have and how can we operate in a somewhat concerted fashion to share information Of course, we all are doing it slightly differently. Our states are different characteristics and needs. But we have the common principles of trying to keep people healthy while understanding that our Midwestern economies are ones that are based on manufacturing, are ones that, where we have a lot of other industries that are different perhaps than are in New York City or in, areas of California. And of course, we've got lots of agriculture here in the Midwest. So we have common principles. And I want to remind everybody that, our coalition is a bipartisan one. We've got, the governor of Ohio, Governor DeWine, the governor of Indiana, Governor Holcomb, along with Governor Beshear in Kentucky and Governor Walz in Minnesota and Whitmer in Michigan and me. And we're talking constantly about what are you doing that we ought to do? How can we do these things together, and especially where we have common borders?
You're talking with Midwestern governors, but are you talking at all with President Trump?
Yeah, so I've talked to President Trump more often, of course, with Vice President Pence. I heard some comments that Governor Whitmer made about the fact that that Vice President Pence was a former governor and understands a lot better what governors are going through, and I will second that. He has been very communicative, very cordial, and I have to say, when I need to reach out to the White House, he's most likely the first call that I'll make.
But President Trump, as you well know, criticized you by name on Monday, just yesterday, claiming you, quote, didn't understand your state's testing capacity. What's your response to that statement by the president?
Well, I don't watch those press conferences because
I just told you what he said.
Yeah, I appreciate it. I try to base all my opinions on fact. But the truth of the matter is that the president doesn't seem to understand the difference between testing capacity and getting testing results. Testing capacity, what he's referring to is, hey, you've got enough machines in each of your states to run tests that will give you, hundreds of thousands of results. Well, he may be right, and he is right in Illinois. But what he's not right about is we don't have the supplies to run those tests. So you've got the capacity because you've got the machines. But remember, you need everything from swabs to, VTM, viral transport medium, to RNA extractor, reagent. And if you don't have all those, and by the way, there's a worldwide shortage of all of those things, then you can't run a test. And then add to that in order to do what he's suggesting, you'd have to run these machines 24 hours a day and 7 days a week. Well, many of these machines are in private doctors' offices, in private hospitals. In order for us to even run any tests, you have to have an agreement with those doctors or with those hospitals, which we've tried to do across the state. But then you need lab technicians that can actually run those tests for you. Well, guess what? In order to run machines 24/7, you need 3 shifts of lab technicians on these machines. So the idea that we could actually do that without the supplies, without enough lab technicians, is kind of crazy. So what we needed was for the federal government, still need the federal government to enact the Defense Production Act to make it easier for us to obtain the swabs and the VTM and the reagent that we need. None of that has been done at the federal government level. That's the mistake that has been made all along here. We could have organized this and led this at a federal level. Everybody, including libertarians, would tell you that the purpose of the federal government at a minimum is to manage a national emergency. And this is a national emergency, and it's not being managed well from the White House.
But why would you want to see the Defense Production Act used versus more appropriations from the federal government to provide you with that testing material?
Well, again, providing us the dollars for the testing material doesn't really do the trick. What we've got to do is, there's a worldwide market for these things. What we need to do is make sure we're producing it and acquiring it as a nation for our states. But instead, what's happening is, just like with PPE, we're competing against each other. Now, that's led to some innovation. In my state, we've had our universities working together to develop our own viral transport medium. So one of those supply items is being developed for us by our own laboratories and universities here. but we need swabs. Those get manufactured by swab manufacturers. What are they doing right now? They're selling their swabs to anybody that is already a customer of theirs, including other nations. And so, that's great that they're in the for-profit, business of selling their swabs, but we're in a national emergency. We need them all here in the United States, and we need them distributed based upon need. The governor of Michigan has a real problem, I know, in Detroit and across her state in terms of the infection rate and hospitalization rate. And she needs to do the testing to know where the outbreaks are coming next. And if we're not supplying as a nation to places where there is a real hotspot, we're not doing it right.
Governor Cuomo of New York is at the White House today, and we hear a lot about the Javits Center, but there's also McCormick Place in Chicago. Have you been satisfied with the way the federal government has handled that and converting it into a hospital?
So the Army Corps of Engineers and the Army and our National Guard here and our great trade unions worked together to build out the first hall at McCormick Place in 5 days. So these Army Corps of Engineer folks and the folks that came to us from FEMA and HHS working together to get that spun up, truly amazing. And I'm grateful for the work that they've done. Look, there's a lot that the federal government can provide to the states, and this was one where, our McCormick Place has turned out to be a great place for us to have surge capacity for our hospitals. But it's on these other items where, leading the entire nation by leading us into the stay-at-home, which they didn't do, giving advice to everybody about how it should be done, and then providing with the Defense Production Act the ability to acquire the supplies necessary for the testing. And oh, by the way, we also need tracing and tracking that goes along with that testing, so you can make sure you have people self-isolating if they've been exposed to somebody. And then, of course, we need the PPE that's necessary. If they had done all of that early on, we would be in a much better place than we are today. Having said that, we've realized that when the President Trump makes a promise, that often that doesn't get delivered upon. And so we're just out here working on our own, what's best for our states, getting what we need and delivering what we need. And we're getting the job done.
You've detailed your view of the federal response, Governor, but what about the president's rhetoric? I asked Governor Whitmer about this liberate phrase when it comes to states. Do you believe, as the governor of Illinois, that President Trump is stoking civil unrest?
Yeah, I'm very disappointed with the rhetoric and messaging coming from the president. We should be pulling people together right now. We are here in Illinois, Democrats and Republicans working together. I have frequent conversations with the elected officials around my state who are not in my own party. And we all share the common goal of opening our economy and getting people back to school and back to normal as fast as we can, but with the overriding concern for people's safety and health. That doesn't seem to be the message coming out of the president when he tweets out liberate Michigan or liberate Minnesota or liberate Virginia. He's fomenting protest, and I hate to say that is fomenting some violence. And I'm very concerned about what that might mean for the country if he keeps doing things like that. We should be bringing people together, not dividing people now.
What do you think it could mean down the line?
Well, I know what he's trying to do. It's a political maneuver in the middle of a national emergency, and he should stop it. But what could it mean? It could mean terrible things. You could end up with violence. You certainly are seeing that people are believing his rhetoric, even repeating the rhetoric that he had a month ago or so, where he was calling this a hoax. And people are going out in public in large crowds. Not in Springfield where there were only 20, but I saw in Michigan and other places, large crowds where they're frankly going to be giving each other coronavirus, and people unfortunately will get sick, and some people may die as a result of the president's rhetoric that has brought them out to protest.
That's all the time we have. Governor Pritzker, really appreciate your time and wish you the best as you deal with this pandemic. Thank you very much.
Thanks so much, Bob.
Thank you all for joining us this afternoon for another conversation on Washington Post Live. We will be back many times this week and in the coming weeks to have more conversations about this pandemic, about how it's affecting your life. If you want to make sure you watch these discussions, go to WashingtonPost.com/postlive. You'll find everything you need to know right there. And tomorrow, Wednesday at 11 a.m. Eastern, make sure to watch my colleague Mary Jordan. She'll have a conversation with former Secretary of State John Kerry and former Ohio Governor John Kasich. We have a lot of Midwesterners on Washington Post Live this week. But for now, I'm Bob Costa. Thanks for joining us, and stay safe.